All right, hey, it's Ramon and welcome to Brain First Radio, science-backed strategies, insights and tools you can use to upgrade your brain and life. In this episode, Dr. Christine Bishara joins me on the show. Christine is board certified in internal medicine by the National Board of Physicians and Surgeons and is the founder of From Within Medical, a medical wellness practice that places emphasis on the mind, body and gut-brain axis to prevent and manage disease. With over 20 years of clinical experience, time and time again, Dr. Bishara has discovered that the connection between these systems plays a significant role in disease prevention and management, but it has not been adequately addressed. Consequently, her therapy involves a multidimensional and personalized approach that addresses multiple physical and biological factors while focusing on strengthening the body's immune system. This includes assessments of individual gut health, determination of antioxidant levels, and determination of neurotransmitter deficiencies. And in this episode, we're going to be talking about gut health and the gut-COVID connection. But before we get into the episode, I want to talk to you for just a moment and tell you about something I'm really excited about, something that has been in the works for many years, which is that we've developed a brain-first nutritional supplement line. Earth-grown, evidence-based, and the highest quality ingredients. Now, when I was looking at the scientific literature investigating the effects of different plant, root, and herb extracts on things like brain health and cognitive performance, one of the things that struck me was that many of the benefits of these extracts on the brain and body actually came from reducing inflammation and pro-inflammatory cytokines, these things that are associated with numerous chronic diseases, and better regulating the stress axis. So when I dug deeper, I found that there were a number of these plants and roots and herbs in extract form, backed by dozens and dozens of high-quality placebo-controlled studies showing how effective they are at doing things like protecting your brain from the effects of modern-day stress and chronic inflammation, enhancing cognitive function and memory, and promoting mental clarity and focus, and supporting brain and cardiovascular health, and boosting your energy and mood. And we have a product with the ingredients and the right amount of each ingredient, according to the research, that have been shown to do precisely these things. It's called Prime, meaning of first importance, because we really want to get the inflammation and stress response under control, eliminating any brain fog, as well as boosting our mental focus and performance and our memory and mental clarity. And Prime has been designed to do exactly that. So go to mybrainfirst.com to upgrade your brain today. Now, let's get into the episode. No interruptions. Enjoy, my friends. Hi, Christine. Welcome to the show. Great to have you here.
It's good to be here.
So how did you become interested in gut health, the gut-brain axis, and strengthening the immune system?
Well, it kind of started back when I was a teenager, actually. I was morbidly obese at the time, and I lost weight. And not only did it affect me physically, but it also affected me mentally, like profoundly. And so that interest in nutrition started at an early age. And then when I went into medical school, just studying biochemistry, studying all the different pathways of nutrition-based pathways, glycogenolysis, gluconeogenesis, all the pathways that kind of help our body utilize fuel, got me really interested in gut health and nutrition in particular. So after medical school, I started working as an internist. I did my residency in internal medicine, and I did that for 20 years. And as much as I love internal medicine, it didn't really allow me to focus on my passion, which was really teaching patients nutrition, right? As doctors, we're so trained to, teach patients about medications and treatment and treat their chronic illnesses, but we rarely have time to really kind of go back and discuss the root cause of their medical illness or prevent any chronic conditions from happening. And so that's really where I decided that, I'm going to leave traditional internal medicine and really focus more on root prevention of disease versus the opposite end, which is treatment. So that's really what got me interested in gut health and the gut-brain axis, just from my personal experience, but everything that I've learned over the years about, the really, really strong link between the two.
Mm-hmm. Why is gut health important?
Well, I don't know if a lot of people realize, but A large part of our immune system is actually in our gut. And, Hippocrates said this like 2,500 years ago, all disease begins in the gut. And I'm always amazed by a lot of his quotes because as rudimentary as, science and medicine was at the time, I think they also didn't have all this overload of choice, right? And so they were able to focus more on disease. And I think that's why he was so wise. And I mean, I truly believe that all health does start in the gut because of the immune system, but also it's gut health is kind of like that precipitant to our overall wellness. So if your gut is healthy, it's great. And if your gut is not healthy, what happens is then, your gut integrity and the lining of your gut, that starts to break down. And then that starts to lead to systemic inflammation. And then when you have systemic inflammation, that's really kind of predisposing you to all sorts of chronic medical problems like diabetes, obesity, heart disease. We've seen so many conditions that are predisposed by gut health. And actually, more recently, I don't know if you've been, reading recent studies about a lot of neurological conditions such as Alzheimer's, Parkinson's. They've now found that a lot of those conditions are actually linked to gut health, and in particular, the lack of gut diversity in our gut. So we're definitely seeing that there's definitely a strong link between gut health and overall health.
And how do we assess our gut health? How do we measure this? What are some of the things that we can do for ourselves, or maybe some of the things that we might notice that might indicate that there's a gut problem before maybe seeking out medical help?
Yeah, that's a really good question. There's so many different things that our gut will kind of signify to us that we're not feeling well overall. Patients will come to me and they say, I'm really fatigued, or I've started developing acne, or, new onset allergies. Like that's a big one that I'll usually start to wonder about, or just difficulty losing weight, or bloating. So many different symptoms. A lot of people will complain of depression, anxiety, and believe it or not, that gut brain axis is so strong that also can be an indicator of gut health. So what I usually do in my practice, and the good thing is the 20 years of internal medicine I do apply in terms of how I assess a patient, and I do a very thorough history. We look into literally, like it's detective work, literally. I mean, we look into like any possible conditions that might predispose someone to a gut health issue, but then we kind of try to tap into the gut brain axis. And then a lot of times I'll do a gut analysis and we'll look at their microbiome, and we'll see what microbes there are. And we now know a lot more about our gut bacteria and organisms in our gut, and which ones have been notorious for causing. I mean, we have bad and good gut bacteria, right? So obviously we want the ratio of good gut bacteria to overpower the bad. And we can identify that in a gut analysis, and then kind of work from there in terms of lifestyle, food, and then adding probiotics or other supplements if needed.
Mm-hmm. What are the things that you've noticed with patients when they improve their gut health? What are some of the specific benefits that they're really seeing?
Yeah, I mean, again, it's kind of the reverse of whatever they were feeling, right? So people will say they have a lot more energy, and I also I incorporate intermittent fasting along with, because that's been really studied too, and that's actually something I've done for over 30 years, and it's really helped me. But again, it's fasting gives your gut that time of rest, right? Our body needs rest. Every cell needs rest. So I incorporate that, but they'll tell me they have so much energy because now their body's being fueled with, other sources such as ketones and glycogen, which a lot of people don't even realize. So that's a big one. They'll say like, I have so much energy, or they'll start to notice that their skin is improved and just looks glowing and better. And they won't have any more bloating or abdominal, distension. There's so many different things that I've heard. Mood improvement is another huge one that I've heard. So weight loss, that's another benefit of improved gut health. And we're starting to see like a lot of people. I mean, I know people count calories, and to a certain degree, yes, we do have to consume a certain amount of calories to lose weight. But there are those people that are resistant because they have the subclinical inflammation that's kind of not allowing them, right, to lose the weight appropriately. And so that's another benefit that I see when patients improve their gut health as well.
And my understanding is that based on the ratio of the good to bad bacteria, that can even impact the way that calories or food is utilized in terms of how it's converted to energy.
Absolutely. We can talk a little bit about how, I guess, prebiotics, probiotics, and postbiotics and how that affects our gut. Um, so, yeah. So think of prebiotics as the plant-based foods that we eat, right? If you think of probiotics as like employees in a factory, just think of it that way. So the probiotics are our gut bacteria, right? So they're employees and they need to produce a product, but they need to be fed to produce that product. So the product is the byproduct is the postbiotic, which is what helps to strengthen the gut lining. So think of a prebiotic as the plant-based foods that our gut bacteria need, right, to function. And so if we're feeding our gut processed foods, foods that are just not really healthy for us, what happens is that feedback loop from our gut to our brain, because we know there is a feedback loop, it really never gets shut off. And so you're constantly feeling hungry because, bad gut bacteria want more of that processed food. So what you want to do is provide good prebiotics, which are plant-based fibers, foods in like probiotics and fermented foods, things like that help to nourish our probiotics, which are our gut microorganisms. And then once they've received their food, right, then they're able to produce their byproduct, which is the postbiotic. So, for example, they produce short chain fatty acids like butyrate, for example, and those help to strengthen the gut lining. But short chain fatty acids have been found to do so many other things, and just strengthen our immune system. So those are really like why our gut health impacts our overall health, is because of that. We have little employees working in our gut.
Mm-hmm. So what are the top, say, 3 to 5 things that we need to be doing or perhaps stop doing for improving our gut health?
Okay, that's a really good question. So first, you really want to increase your plant-based fibers because those have been shown to help our good gut bacteria thrive. And those are really what you want to eat more of. So what I usually recommend to my patients is a 70-30 ratio, where you're eating at least 70% plant-based and then 30%, whatever other protein you want. I mean, some patients are completely vegan and that's fine. But I recommend at least a 70% plant-based fibers, because those are really the prebiotics that feed our gut bacteria, which are the probiotics, right? So, and once our probiotics are fed with good nourishment from prebiotics, then they're able to produce great byproducts, which are short chain fatty acids that help to strengthen our gut lining. And so if our gut lining is strengthened and healthy, then what's meant to stay in the gut stays in the gut instead of being leaked out into the bloodstream. And that's really where we have problems, is because if your gut integrity is compromised, then toxins or things that are supposed to go out into the stool leak into your bloodstream. And then your body doesn't recognize these things. So then it kind of initiates an immune response to it. And then this is where that term, when someone's called inflamed, right, or they have inflammation, that's really where that term comes from, is because now they have these immune responders that are kind of like always on alert in their body and they're chronically inflamed. So that's what we're trying to avoid by doing that, is just feeding our gut really healthy foods. The other thing we really want to do is limit our processed foods. Limit artificial sweeteners, because those do impact our gut. I think every artificial sweetener that's been studied has shown to be a gut disruptor. The only ones that they think, they think might not really affect the gut, but again, they've been around for a short time, so it's not definite. Are stevia, which is from a plant-based source, and monk fruit. But again, I always say, like, just keep those in moderation. What I like to recommend to patients who have a sweet tooth and they say, I really need something, and sugar is their thing, which is another one that we really should be limiting, sugar, because it's also a gut disruptor, is add honey. And you guys actually have Manuka honey. Manuka comes from Australia, right? Or New Zealand. Yeah. That's a big one that I really like. So that's definitely another one. I know a lot of people are going to be upset with me right now when I say this one, but alcohol is another big gut disruptor. Yeah, and I think a lot of people kind of are, I guess, misinformed about how much alcohol they should be having. But I mean, I would even say like if it's more than once a week, it's probably not really that great for your gut. If you think about how alcohol affects like your skin, for example, when you use hand sanitizer, like what is it doing? It's killing all the organisms, right? And so it's kind of doing the same thing in your gut. But then it does all this other stuff too that's really harmful for the body as well. So that's definitely another one. Limit your alcohol intake.
What about the quantity of alcohol in, like, let's say you drink alcohol once a week, but what about the actual quantity itself that you're drinking?
Yeah, I think that impacts it too, right? Because the stronger the alcohol, obviously, the more potent it's going to be, killing more organisms. So definitely makes a difference. Um, a lot of my patients, sometimes I don't know if they listen to me or not, but I say like really try to limit your alcohol intake to like not more than once a month, if you can. So, but yeah, because we have seen that that's also a factor that definitely is a gut disruptor. Try to eat organic as much as you can. Another big one, because already our soil is not as rich as it used to be 50 years ago. But now we're spraying all these pesticides, and unfortunately, that stuff leaks into our food. And again, that has been studied to also disrupt the gut. So those are all things that I would say, like if you're just going to start out, is limit your sugar intake, alcohol intake, increase your plant-based fibers, which are your prebiotics, right? The other thing is really increase your what I call edible probiotics, which is like fermented foods, kefir, things that have already like live cultures in them. Like those have been really beneficial too. And we can actually talk about societies that incorporate all of these aspects, and they've been shown to have healthier lifestyles than the average American or the average person that's eating like a processed, mainly processed diet.
So when you say edible probiotics as opposed to like, getting one of these yogurts that's had a whole bunch of bacteria added to it, right?
Yeah, I mean, I also believe in like meeting a patient where they are. So if, for example, they're just starting out, take a probiotic, like a pill form. That's great, right? Just to get you started, because not everyone's going to go from 0 to 100, right? Where they're eating like 70% plant based. But yeah, so you definitely want to look at your ingredient list because that does make a difference. I mean, yogurt, with added sugar or whatever is not that great. I mean, if you're eating like a live, yogurt that's been fermented, it's great for you. Kefir is another one. Kombucha, apple cider vinegar, miso, sauerkraut is really good. There's so many that if you just incorporate a little bit, a few times a week, even makes a huge difference.
Prebiotics more important than probiotics?
Um, I think so. Just from the studies that have come out, they're more. I think they're both important, but I would say if you're going to focus on one, definitely prebiotics, more plant-based fibers, obviously, because those really provide the food for your bacteria. And not only that, but they have the fiber, right? That helps keep you regular. So there's definitely, I think, prebiotics are probably a little better than probiotics, but I think if you incorporate both prebiotics on a daily basis, definitely, edible probiotics and supplements also daily, but if you can't, then every, a few times a week. We're all a work in progress, right? So
Right, exactly. 1% improvement
yeah,
bit by
exactly.
bit.
And actually, there was a study that came out because in the US, they recommend 5 servings of fruits and vegetables daily, which is to me, I think it's good, but a lot of people don't eat that much. But they found even if you go up to like 3 and you work your way up to 5 servings, it does impact your health. And our gut is amazing in that it actually the diversity and the what's the word I'm thinking of, like what's in our gut microbiome changes pretty rapidly, and so it's affected. Like if you eat a good diet for a month, you'll actually see a huge difference in your gut microbiome within like after that month. So it does tend to change in a rapid basis. Yeah. And our gut does change, like our microbiome changes. I mean, even if you travel, like if you go on vacation, it's different. Your gut microbiome is probably very different from mine, because you're in Australia and I'm in the US. But yeah, so our gut is open to, good change. We just have to get started on that.
Mm-mm. Hmm. When did you make the connection between the gut and COVID? How did that all come about?
Yeah. So I live in New York City. And when COVID first hit the US, it kind of hit New York pretty early, like in March, right, of 2020. And so my practice, because it's not like urgent and like on an emergent basis, it was considered non-essential. So yeah, most clinical physicians who weren't in like emergency medicine type situations were actually considered non-essential, and everything was shut down. My husband, on the other hand, is a pulmonologist and an intensivist. So he had the opposite effect on his work schedule, because he sees ICU patients. So he was actually like thrown into this like crazy new schedule of 24/7 coverage, where they were literally like spending the night at the hospital, covering ICU patients. And so he was seeing patients early on. And he also has 20 years experience in ICU medicine, and they have a protocol. But with COVID patients, they were seeing that things were a little bit different. In addition to the patients that we already know have the risk factors for getting more severe COVID infections, those who are elderly with predisposing conditions, he was finding a lot of patients that were on the younger side, but maybe had higher BMIs than normal, were getting really sick. And so they were actually testing their inflammatory markers to see how inflamed they were, to measure, right, the severity. And one of the markers that they were checking was interleukin 6. It's called IL-6. So, and I can go into that a little bit. So our body kind of releases these cytokines, right? I don't know if you've heard of the cytokine storm. Yeah. Okay. I can explain a little bit. So the cytokine storm is basically what happens when patients get really severe COVID infections. And the mechanism behind a cytokine storm is, it's kind of like what we spoke about earlier with the body's immune response and how it responds to an infection. So he was seeing that a lot of his patients with the cytokine storm had very elevated levels of IL-6, which is this inflammatory marker that they checked for. IL-6 is released by our immune system. It's one of those acute responders, and it's released by our immune system in response to an infection. So if you have a healthy immune system, what happens is your body senses, COVID, for example, and releases this acute responder, among other inflammatory responders. I'm not just blaming it on IL-6, but they do their job. They try to contain the infection as much as possible, and you don't get that sick. In certain individuals, however, they already have subclinically elevated levels of IL-6. So their levels are already much higher than someone who has a healthy immune system. And the best way to describe that is they're already inflamed, right? So their immune system's already on hyper alert. So when they get an infection like COVID, their body has to go into like this chaotic overdrive, where they're now really having to try to contain the infection. And so the body doesn't respond as well. And so this cytokine storm develops, and the cytokine storm, unfortunately, causes more damage to the tissue, the body's tissue, than the infection on its own. So, and that's what ends up happening with these individuals, is that cytokine storm, their body's kind of responding to this infection, but it's causing damage everywhere because it doesn't know how to react appropriately. And so what he was finding was patients who were overweight had elevated levels of IL-6. And knowing that, I worked with obese patients, he asked me one night, it was like the fourth night that he was, on call, and he said, do patients who have high BMIs have elevated IL-6 levels? And I said, yeah, I think they do, actually. And it's one of those markers that's actually high in a lot of people with inflammation, like diabetes, the same people that are getting really sick. So, we kind of like just were thinking about that. But then I just started thinking, well, what is it about kids, right? That they're like, kids weren't really getting sick, right? So what was it about kids that kind of protected them, right? So we started looking, and I knew that kids' guts were much healthier than adults, right? So I kind of started just probing a little bit about the microorganisms in children's guts and their microbiome in comparison to adults. And interestingly enough, their microbiome is very different from ours. And in particular, they have a very high concentration of one particular gut bacteria called bifidobacterium. And it's interesting because bifidobacterium, I mean, it's in every probiotic. It's been thoroughly studied. I mean, it's literally everywhere. So the reason why kids have a much higher concentration in their guts versus adults is because it's like nature's way of helping them build their adaptive immunity. And believe it or not, bifidobacterium actually regulates the same immune pathways that COVID seems to be affecting, right? When these patients who get really severe infections. So one of the things we found was bifidobacterium actually downregulates IL-6, that one that we were seeing. So we think that perhaps what's going on with children is they get the infection, they have such high levels, right? And so they're able to contain this infection right away because of the immune markers that they have, downregulation of IL-6, but then it also upregulates another inflammatory marker called IL-10, which is an anti-inflammatory marker. So you're downregulating this like pro-inflammatory marker and upregulating the anti-inflammatory marker. So to us, it made sense, right? But it also was working on interferon. I mean, if you study bifidobacterium, and there's so many studies out there on it, it's amazing, right? So that's where we kind of said, you know what? I think that might be why children are protected. And oddly enough, while we were doing our research, we found a study where they checked centenarians, who are people who live to be 100, Japanese and Italian centenarians, the guts, and they found that they actually had higher levels of bifidobacterium in their gut than the non-centenarian elderly. So, like a lot of things that we were finding just kind of made sense. So we published it back in May, and I've been recommending to my patients to increase their plant-based fibers because bifidobacterium is, acquired from plant-based foods, but also adding a probiotic containing it. And early on when we published this, it didn't get as much traction. Like there wasn't really a lot of interest in it. I don't know why. For whatever reason, it wasn't reported as I guess as we had anticipated. But oddly enough, since our initial publication, I believe ours may have been the first one kind of to link the gut to COVID. Since ours, there have actually been 3 additional studies that have basically validated what we said initially. There was a study out of Italy back in August of 2020. Dr. Claudio De Simone, he did a clinical trial where they gave patients, they kind of divided patients into the patients who just received the standard COVID protocol versus ones who received the standard protocol plus a really high dose probiotic containing the bacterium strain, but also other strains. And they found an 8-fold decrease in respiratory symptoms in the group that received the probiotic, and eightfold decrease. Yeah. And they found that group, not one single one needed to be ventilated. That was one study. Then just a few months ago in January of 2021, a big study out of Hong Kong University that was published in the British Medical Journal. They actually studied the guts of patients too who had severe COVID infections, and they found, believe it or not, those patients did have gut dysbiosis, and one of the deficiencies was found to be bifidobacterium. So that was another one. And then just recently, another study coming out of Israel a few weeks ago, where they gave patients kefir and yogurt with live cultures, and they found that their symptoms improved. And, we know that those have, bifidobacterium, lactobacillus, beneficial gut bacteria. So now it's really kind of, it's more of a, like a valid theory, I think, that, dysbiosis definitely can affect your response to COVID. And we're seeing that in patients who are overweight or have diabetes or other chronic medical conditions because of the inflammation, right? The gut inflammation that leads to systemic inflammation.
So what are the things that we need to be doing if we know there's, say, a chance that we could contract COVID?
So my patients that I've been seeing, I've kind of have them on this preventive protocol, which is vitamin D, vitamin C, zinc, and a probiotic containing bifidobacterium. So those things I've already had them on. The ones that I've had that actually developed COVID infection, I basically doubled the dose of whatever they were on, so that they can, their body can kind of fight the infection. And actually, like the majority of the ones that I've seen have fared pretty well. So definitely, obviously diet, and I don't want to stress this like enough, but like diet really is the most important factor. But again, as we mentioned, like you kind of have to meet everybody where they are. So if it's someone who's just starting out, then we want to really kind of, because it's like an urgent matter where you don't want them to get COVID, right? Give them the supplements that they need and then work on the diet. But first and foremost is always diet. So, just increase your plant-based fibers. It's never too late to start a healthy lifestyle. And in combination with that, the edible probiotics that we spoke about, and just get moving. Even if you don't live in an area where you can exercise, like just take a 20-minute walk. It's as simple as that. And there was a study that came out on, again, it was the centenarians, and they found several factors, environmental factors that predicted your longevity. And one of them was living in a neighborhood where taking a walk was something that was accessible and easy to do. So they found that people who tend to walk more frequently on a daily basis, actually that translated into, longevity. So, yeah. Those factors, I would say, start with that. Fruit and vegetable consumption. They have antioxidants, which are really, potent and help to fight off free radicals in your body, which are free radicals basically are what cause damage to cells. And so the less free radicals you have, the better you are to fight off something like COVID. So, fruits and vegetables have antioxidants, so they kind of fight off the free radicals by stabilizing them.
Diet and exercise. Surprise, surprise.
Yeah, I know. All those studies are actually, turning out to be valid. So.
Awesome. Any final thoughts for our listeners?
I would say don't beat yourself up about being perfect in your journey. We're all different. We all have different needs. Just, start slowly and kind of work your way up. And, what I tell my weight loss patients all the time is success is not like a straight upward trajectory, right? It's this, right? It's so if you have the up, that's great, but you are going to have a down. And I think what happens is most people, they have that down and then they give up or they say, no, I'm useless. But that's life, right? So you want to just kind of ride the waves. And so that's what I would say is just know that you can always redirect. And it's a normal part of, any journey to success, whether it's weight loss or anything career related. So.
Absolutely. Christine, thank you very much for being on the show. I really appreciate your time.
Absolutely. I had a wonderful time chatting with you.
So that's it for this episode. If you want to support the show, make sure to subscribe on Apple Podcasts, drop a 5-star review or follow us on Spotify. And guys, make sure to head over to mybrainfirst.com to check out the latest resources and products to help you upgrade your brain and life. Thanks for tuning in. Talk to you soon.